您正在收看的是新西兰报中心之窗试点。
Different things. Are you talking about the needing to pay for medicine for the prescription?
Yes.
That is our policy. Yes.
Yes.
So, and you're asking is national going to cancel it?
Yeah.
Yeah.
So
That's right.
Yeah.
It's very important to me that people get the medicine they need.
Exactly. Because I saw your announcement from the publication. So I really agree, but we got a little confused because we lost our friend and a colleague. Some colleague working for the hospital as well. So they're asking, is it true? Because they were more like patient getting to pay more fees when the National Party getting the...
That's right. So National has said they would cancel the free prescriptions for most New Zealanders.
Yeah.
We think it's important for everyone, and I'm determined to keep that as part of our health policy.
Okay. So at the moment you don't know if the Labour Party is on, so we're still getting free prescriptions.
Yes, certainly. I promise. That is definitely our policy. Yeah.
Yes, because people was really worried about that.
No, it is National who is proposing to cut it. We will keep it. We are very happy with that policy.
Yes. So we just want to identify that how the Labour Party announcement is because it's election really soon.
Yes.
So we want to know how they exactly.
So I brought that policy in May or July. It came in July, and we are determined to keep it if we are re-elected.
Great. Yeah.
So free medicine.
And another thing, because for the free spectrum screening for the woman from 25 to 69 years old.
Yes.
And at the moment, we know it's free to do the test, but you need a booking with your GP to pay your GP fees.
Yes.
Is that means when the Labour Party will still continue to be the government win the election, so it's for all free?
Correct. We want to, when we introduced the new technology for the test, that makes it easier for women, and they can, with support, do their own test.
Oh, great.
Then, Te Whatuora is subsidising it for some. Labour has said if we come in, if we are re-elected, we will make it free for everyone.
Oh, great. That's what we're wondering, because it's quite concerned about that, because at the moment we need to pay the GP fees to do the free test.
Yes, I know. My view is that those preventive things like vaccination, screening for bowel cancer, breast cancer, cervical cancer, those prevention things should be free.
Great.
We have to pay them, and that is why it's so important that we fund our health system for inflation, because that is how the wages of our workers grow. National's unfunded tax cuts will mean National won't have enough money to fund wages, and doctors will leave. The second thing is we can look after our people better in the health system.
Yeah.
For example, I went overseas to finish my specialist training in Singapore, but nobody was waiting for me to come back to New Zealand. Nobody emailed to ask if I was coming back. I had to ring all the specialists and ask if I could have a job. In the future, because we are now one health system, we can offer New Zealand doctors before they go overseas a job and say, we will give you a job when you come back. You are on leave without pay. Go do your training and then come back. We will find you a job. And because we now have one health system, we will be able to guarantee there will be a place somewhere in the country for them.
Okay, so that means that firstly you increase the doctors' pay rise, but they are really hard working. I can see, especially in the hospital. And secondly, you are a private keeping them position, even they go overseas to study or something reason for the work.
That's right. And of course, there are many things we want to do to improve their conditions, and one of the main things we can do is reduce the vacancies among doctors.
Okay, great. Thank you.
My pleasure.
Thank you so much.
Yeah.
Because I got a few parents. There is a doctor, so they will